Good evening, Mr. Mayor, members of City Council. Jason Knighting, 557 Beards Hill Road, Aberdeen. Also President of the Hartford County Municipal Fraternal Order of Police Lodge 128. I'd like to read into the record a letter that was sent to the council members earlier today. Dear council members, I'm writing you because there's great concern with Mayor Patrick McGrady's proposal to switch from Cigna Healthcare to Evergreen Health. Mayor McGrady has contracted a friend from his church, Gary Wilson, to shop, Mr. Wilson being a broker, to shop for health care for the city employees. No other brokers were contacted to my understanding. What is the compensation Mr. Wilson will be receiving? What line item out of this current budget is Mr. Wilson being paid from? It is my understanding that the Human Resources Director for the city has always shopped health care and provided comment on that. The mayor indicated to the employees that the city will be uninsurable by Cigna in 2 to 3 years due to the number of claims filed. This was told to him by Mr. Wilson. If claims are so high, will the city not find themselves in the same situation 2 to 3 years with Evergreen Health? How could an entire city be uninsurable to begin with? This sounds like an inflammatory statement meant to intimidate and affect a rushed decision. The mayor indicated that there will be a 17% increase in health care with Cigna to the tune of $350,000. He has further indicated that the city can save $950,000 by leaving Cigna and going with Evergreen. As of this morning, I heard that number changed to over $1 million in just a couple of days. Where will the remaining, I asked the mayor where the savings would go, and he indicated a proposed 1.5% COLA for employees. Where will the remaining savings go? The mayor indicates by changing to Evergreen Health, it would be cheaper for employees for the first year. Subsequent increases in years to follow were not discussed and are unknown. It is my understanding from the mayor, the city's finance director also questions the savings. But according to the mayor and Mr. Wilson, the numbers show the savings. If the finance director of the entire city has issues with seeing the savings in the numbers, is it really that obvious? One of the best benefits this city has to offer its employees has been health care. At times in the past it has not been the best, however the last few years it has been great. Even the mayor acknowledged it is the gold standard. I have spoken to several employees of the city and they are not pleased or happy. The notion to change health care providers was completely rushed. It appears the entire process has only taken about 2 weeks. It sends the message the city does not care about the health of its employees or their families. The mayor nor the broker use the city's health care, therefore they would not know the benefits or success employees have had with Cigna, nor the significance of what it means to the employees and their families to have full confidence in their health care and well-being. It was recommended to the mayor that the city keep Cigna for FY 16-17 and convene a committee of employees from all departments throughout the city to study healthcare options for fiscal year 17-18. The results of that study then be presented and a recommendation made. It was also recommended that the city contact Cigna to find out what alternatives we had with the current plan or other plans that they offer. Other suggestions will be to take a poll of the employees to see where they stand with Cigna versus Evergreen Health. The decision to change an entire city's government health care provider is not one to be taken lightly or rushed in the slightest. This process has been more than rushed, and employees were only given one option. The company that has been selected to replace Cigna, Evergreen Health, has only been in existence for 2 years. In those 2 years, they have a 1.9 satisfactory rating out of 5 from their customers. According to the Better Business Bureau of Greater Maryland, Evergreen Health is not even accredited. Therefore, the decision has not only been rushed, but the company selected appears to be substandard. This is not moving the city forward. In closing, I think you can read from this letter, the mayor indicates he does not need a council vote to change healthcare providers. He only needs the money to be approved in the budget. It is obvious to many employees that the mayor has already made up his mind to change the employee's healthcare provider. I ask you tonight, the 3 council members, if there is a vote on the 16-17 budget, that it you vote no until we can work out this health care resolution. The mayor does have an obligation to the citizens of Aberdeen, and that is to reduce the budget and spend wisely. This decision, however, is being done on the backs and shoulders of employees who are being forced to accept substandard and unproven benefit. Those same employees' backs and shoulders may not even receive the proper health care after trying to support a hasty decision by the mayor. Thank you.
Thank you, Mr. Nutting.